So as far as the meds, as far as sub-Q insulin, there is rapid, short or regular, intermediate, and long, which I texted you the picture of that. So the rapids, the mnemonic I did for that is LAAL. So that's your logs, aspart, Apdera, and Lispro. And the saying for that is 15 minutes feels like an hour during 3 rapid responses. And remembering that hypoglycemia is the highest risk during the peak of the meds. So rapid, that was rapid or faster acting. Then there's short or regular. So short and regular, I think of a girl named Lynn who is very short, and most girls are short, so that's pretty regular. Her name is Lynn because there's Novolin and Humulin, and the saying for that one is short staff nurses went from 30 to 8 patients, so 30 minutes, 2 hours, 8 hours. Intermediate is NPH. I just know that because NPH, I think of it as being kind of a newer or more difficult insulin since it's cloudy and there's all those rules with that. So I think that it's very intermediate or like advanced. And the saying for that one is nurses play hero, NPH. Nurses play hero to 8 16-year-olds. So 2 hours, 8 hours, 16 hours. And then long. For long, I think of the word long, Long, but instead of the O, it's a D for Detamir. So LDLG is the mnemonic for that. So Lantus, Detamir, which is Levemir, and then Glargine. And you never mix longs. That's the big thing. And the 2 long nursing shifts never peaked but lasted 24 hours. So 2 hours, no peak, and lasts 24 hours. And then as far as the different oral agents or other anti-diabetic meds, the first one is the biguanides, which is metformin and glucophage. So M and G there. And the big things with that one is di, because it's toxic to the kidneys. So metformin is always held like 24 hours before something with a di and 48 hours after. The function of it is that it lowers glucose production and intestinal absorption of glucose, and also improves insulin sensitivity. So with that one, I just kind of know that. There's not really any tricks for that. Then we get to the insulin secretagogues, which do exactly what it says. They increase insulin secretion. And there's 2 subcategories for that, the sulfas and the meglitinides. For this whole insulin secretagogues, I have GAPS, GAPS. So glucotrol and amorol are the sulfas, and then meglinides are the Prandin and Starlix. So that encompasses GAPS, GAPS, 2 per subcategory. The biggest thing for all of them is hypoglycemia is a risk, and they're all taken before meals. So just having to remember that S is on the top and consists of GA, and then M is on the bottom and consists of PS. And that hypoglycemia is a risk, and 30 minutes or right before a meal for both subcategories. Then we get to the thiazolidinediones or whatever. Everything with this one has to do with an alcoholic because the meds are AA. So alcoholics pee a lot, so I think of a thiazide diuretic. So that's how you can remember that it's got thiazide in the name of the category, so AA, and one of them is AO, and the O, like Lisa said, makes me think of like a round person, a fat person for actose. So think of like fluid retention, weight gain. Being an alcoholic is a sensitive topic, so it increases insulin sensitivity, and alcoholics have liver issues, so it can cause liver impairment. So the big thing there, AA, one of the A's has an O in it for weight gain, liver impairment, sensitive subject, think of a thiazide diuretic. Alcoholics pee a lot, so AA, don't give it to a patient with heart failure because they already have fluid retention, and with the weight gain here, fluid retention is a concern there. Then we get to the alpha glucosinase inhibitors. So The letters there are PG. For this one, the food is pretty good. So I start everything off by like a wolf pack with like an alpha wolf. So that's how I remember the category. And these pack of wolves are going to feast on a deer. And that deer looks pretty good to them. PG, precose, and glycet. The alpha wolf always gets to eat first. So take it with the first bite of your meal. And that deer looks really appetizing, so they want to eat it really slow. So it slows absorption of carbs, thereby decreasing glucose and preventing post-meal hyperglycemia, because when you eat, your glucose goes up. So it prevents that by slowing absorption of carbs. Take it with the first bite of the meal. And when you eat something very appetizing or pretty good, you're going to eat a lot of it. So you're going to have like flatulence, diarrhea, and a tummy ache or abdominal discomfort. So think of a pack of wolves there with a pretty good meal. Then you get to the DPP4 inhibitors with the JO, Januvia and Onglyza. Joe, think of him as the person who prevents the bully or the enzyme that breaks down incretin, which is like insulin. So Joe saves you from the bully, which is the enzyme. And bullies punch you either in the gut or the nose. So side effects are pancreatitis and nasopharyngitis. Joe protects them from the bully, which is the enzyme that breaks down insulin. So thereby, if they're inactivating that, then insulin is available to lower glucose. And then we get to incretin mimetics, which is BV. So this is another alcohol one, black velvet. You drink it down your throat or your thyroid, so it can cause thyroid tumors. And black velvet is a whiskey, so it's probably going to make you throw up, so nausea and vomiting or other side effects. And alcoholics mimic idiots, so it's an incretin mimetic. To me, that sounds like they mimic idiots, alcoholics. So black velvet for the incretin mimetics. And then amylin analogs, if you remember her drawing a B for beta cells, which secrete insulin on the top. On the top, the beta cell deals with insulin, and on the bottom part of the B, it's amylin. So amylin, think of insulin. It's just like insulin. The med here is Similin, so the big thing is an S here. Similin is the same as insulin, given sub-Q, causing severe hypoglycemia. Same as insulin, so it acts the same way, but you're just going to want to give it in an area away from the insulin injection site, and causes severe hypoglycemia. So all S's here. Sodium glucose cotransport inhibitors is IF, Invokana, and FAR Exiga. So IF, if you're going to take the newest class of anti-diabetic meds, watch for UTIs if you're going to take the newest class. So the sodium glucose transport inhibitors is all about UTIs. What are UTIs consisted of? Sodium and glucose. Urine is very salty, and glucose causes a UTI. So that's the category, and the letters are IF, and a side effect is UTIs and everything that goes with them. So dehydration and everything like that. And then the last one is the combination agents. The name is Glucovance. That's very advanced. That's a very advanced form of insulin. So it contains two, because it's so advanced, it has two. So diabeta and then metformin or glucophage are the two components that make that up. And also make sure to see the Quizlet flashcards that I sent to study as well.